I'm Dr. Vizniak, and I'm here to take you through the 3 parts of a differential diagnosis. Now, one of my biggest pet peeves, being a physician now for 20 years, is receiving letters from other doctors and therapists where they give you a diagnosis of something like ankle sprain or TMJ is what you're looking at. All right? It's totally fine. You guys can make noise, you can ask questions, you can do whatever you want. So, the first thing is you have to realize there are 3 key parts to a diagnosis that you should include. The first one is the stage. The second is the severity, and then the next one is going to be the part of the anatomy that is actually damaged. So stage, severity, and anatomy damaged. And we'll give an example. Let's say that you get a referral letter from another doctor or therapist, and they go ahead and tell you that this patient has suffered from an ankle sprain. Well, what can I really do with an ankle sprain? I don't know if it's eversion or inversion. I don't know how you really assess. I don't really know what's going on with that injury. But an example would be a severe acute inversion ankle sprain. What does that mean? Severe gives you the level of injury. And the grading of injury winds up being mild, moderate, or severe. If it's mild, it's a relatively simple injury. You can work your way through it. The rehab process is going to be fairly quick. And we can put up a little poster right here for you guys to see what mild, moderate, and severe would be grading if you're looking at muscle strains versus ligament injury versus all of that. The next thing is going to be the actual stage of injury. Is it acute? Is it chronic? Or is it subacute? Okay, or is it even better yet, chronic recurrent potentially you'll see as well. So a couple of things that you should be aware of there. If it's acute, when did it happen? Probably within the last 3 days, relatively acute injury. A lot of people make a confusion with that. They think acute means severe. Acute does not mean severe. Acute means it just happened. The next one is going to be subacute, so you're after that 3 days, but maybe you're out a couple, 3 weeks, something like this. And then chronic, that varies depending on the condition. It's kind of a loose guideline, but if you've had something for a month, a couple, 3 months, now you're looking at more of a chronic condition. And for a lot of people, especially in low back pain injuries, what do you tend to see? Chronic recurrent injuries, where it's a little bit of pain, then it goes away, then it comes back, then it goes away again. 3 parts of a diagnosis are stage, severity, anatomy that's damaged. And a good example of one, instead of just saying inversion ankles or ankle sprain, you would say inversion ankle sprain with associated tarsal instability and strain of the fibularis longus and brevis muscles. Now you have something that you can actually work with. All right? And you tell me, which one makes you sound a little bit more professional? Ankle sprain or the long definition that gives you more that you can work with? Yeah, the longer definition works way better for you. So when you are writing your diagnosis or differential diagnosis in practice, I would strongly encourage you to use the 3 parts of a diagnosis. And in fact, there's even more than that. If we refer to the physical assessment or orthopedics manual, you can go ahead and see the 3 parts of the diagnosis here, and we can walk you through that.